distracted and he couldn't pay attention in class. So he said, it helps my teacher not get angry with me, but I don't have any good ideas when I take my medication. So then we had to rationalize with him about the fact that, and the psychologist had to do some individual work with him, saying that in the classroom, sometimes we should keep our brain focused on this.
This podcast shares personal stories and professional insights, but it's not a substitute for medical advice or therapy. If you're looking for support, do speak to someone qualified and trained in child development or special needs care. You'll find the full disclaimer on the screen and in the show note.
Welcome everybody. So this podcast aims to empower, support and inspire families with neurodivergent children. So I'm Carmen and today I have Kevin that we both co-host for today's episode. And today's topic is one of the topic that parents will have a lot of concern, question and emotion, when we talk about the use of medication in children with autism and even children with ADHD. So many parents wonder, does my child need medication? Will the medication really change them? And what is the side effect and all this thing? So today we actually very blessed and we are delighted to have Dr. Ragini again with us today and to share with us the experience of her journeying with so many parents for the past 30 years. Yeah. So she's actually the best person that we can ask in terms of all this very serious topic, because a lot of parents, a lot of things they will do by themselves, but in terms of medication they cannot do by themselves, but they have to seek help from a doctor.
Marks.
Yeah, correct. So at this point, maybe we can ask doctor to share with us, when the parents should consider medication. Yeah.
Okay, I think in our last episode we talked about using different strategies, right? To try to see what we can do before we consider medication. Yeah. Some people would argue you should start medication and behavior strategies at the same time. That may be true if we are meeting children for the first time, and if we see that it is going to be a do or die situation. And what do I mean by that? So I do have children who come to me at the age of 8+ and they're on the verge of being kicked out of school because of their behavior, right? And this may be children who have only ADHD alone, or they may have ADHD with mild autism, etc. So obviously before we start medication, we would want to give a trial of lifestyle changes first. But if we are going to start medication, for me as a practitioner, I would look at the age of the child. So I would not consider medication as first line in any child under the age of 6. Okay. Above 6 to 7 is a gray area where I may still want to get parents to try behavior strategies. Above 7, depending on how their ADHD is impacting their functioning at school, at home, at daycare, etc. It all depends. But before we start medication, we often have to talk about what are the side effects, what are the benefits. And I'm always clear with parents that, anything that you take, even if it's a supplement, if you have too much of it, it's no good for your body, right? Yeah. Okay, it's the same with food. If you have too much of something, right? So if you have too much of certain foods, it will affect your body too. Yeah. So it's the same with medication. So we need to balance the positive effects with the side effects or the negative effects. Yeah.
So doctor, how many types of medication that are available in Malaysia?
Okay, so for the management of ADHD, we have what we call stimulants and non-stimulant medication. How do we classify it? Based on how it works and where the drug is made from. So your stimulant medications are usually what we call amphetamine derivatives or methylphenidate, meaning it comes from a stimulant drug and then they make it into a medication that can be taken. Now, it's not like buying the amphetamine drug in the street that are out there, okay? That is like 1,000 times more potent than what we give our children. But for those of you who drink coffee, what does caffeine do? It makes you more alert, right? Okay. But at the same time, if you take too much coffee, it causes your heart rate to increase, and it can also have an effect on your blood pressure. You may have headaches if you take too much coffee. So these are all the side effects of it. So in the same way, if we take the idea of a stimulant is to make the brain more attentive or alert, right? And less distracted. That is the aim of the stimulant medication. We are lucky in Malaysia, we don't have a huge choice. We're lucky or we're unlucky, I'm not sure.
Is it lucky or unlucky? I'm not too sure.
Okay.
Let me explain.
But in my experience, I think we're lucky and we're unlucky. Okay. But basically, for what we have methylphenidate. And there are three brands that are available in Malaysia: Ritalin, Concerta, and Medikinet. And the brands are different in the sense that how they prepare the methylphenidate is different. So the short-acting one, we have Ritalin short-acting or immediate release, okay? And that lasts for 4 hours. Then you have Ritalin long-acting, which is supposed to last 6 to 8 hours. Medikinet and Concerta are both long-acting preparations. And the duration varies. So Medikinet is supposed to be around 6 hours. Concerta is supposed to be 8 hours, 8 to 10 hours. And it's how they're prepared and how they're released that makes it different in terms of how long it lasts. Yeah. In terms of deciding whether stimulant or non-stimulant, stimulant medications have better, more children respond to it. So if you have 100 children with ADHD, 85% of them, 85 of them will respond positively to methylphenidate, stimulant drug. The other 15% will not have good response. Okay, amongst the 85, there will be some who have side effects, right? But most of the time, the side effects are mild and they are able to continue with it. But there are a group in there, although they respond positively, they have bad side effects. But we'll come to that later. For those who don't respond, then we would consider the non-stimulant drug. Now, why do we wait? Because with non-stimulants, you have to take the medication every day for it to start to have an effect. With stimulants, you will see the effect straight away. With non-stimulants, for the first month, you might not see that the drug is giving a positive effect. It's just the way it works, okay? So, and then you cannot, and once you take it, the effect is supposed to be there all the time now, okay? But if we give 100 children with ADHD stimulants, about 65% will respond. So you see the response rate drops, yeah. And in some cases, there may or may not be more side effects like headaches, etc. Yeah. The other thing is stimulants, it's a pill you have to swallow. Non-stimulants, it's a pill you have to swallow. For stimulants, it's also a pill, but the immediate release Ritalin we can crush. And the Ritalin long-acting and Medikinet, you can open the capsule to let the beads come out. Okay? So for...
And at least drink with something.
Yeah, or put it into a sandwich or something like that. Yeah, as opposed to the kids who cannot swallow a tablet. Yeah. So in Malaysia, the non-stimulants, we only have atomoxetine. There are other drugs that are used, clonidine, but some of these other drugs can be difficult to get in Malaysia. Like it's only licensed for specific usage, and we have to get permission to use those medications. So certain hospitals may carry it, like GHKL or UMMC, but to be honest, I don't use some of those rarer drugs like clonidine, etc., because quite often I haven't needed to use it. Okay, but access to it is also limited.
So when you say that it's lucky to have limited, it's because so parents doesn't need to go through so many.
My belief is sometimes when you have too much, it gets abused. Not by the parents, by the doctors. Okay, that's a whole load of other issues lah, with pharma trying to influence you, etc.
How much that per pills, that kind of thing?
So I'm not sure exact price, but each tablet of Ritalin immediate release, which is 10 milligrams, can cost you about 5 ringgit or close to 5 ringgit, right? So not cheap. If you're taking, most kids will take a full tablet every day. The longer acting ones goes by dosage. The higher dosage will be more expensive, and you're talking, the range can be anywhere between 8 to 12 ringgit per pill.
Per pill.
Yeah.
200 to 300 a month plus.
Yeah, or more, yeah. And if you go to government hospitals, they are also restricted in how much they can prescribe. And actually there has been an increase in worldwide prescriptions, and we are also seeing shortages of medications in the market as a result post-pandemic. Yeah.
Okay. So actually some parents, if say the child really benefit from the medication, and they can actually go through government to get it for free or with minimum charge?
There are minimum charges, I think. Although, no, I think if you go to a government hospital, not university hospital, a government hospital, you may be able to get Ritalin for free. I'm not so sure Concerta, whether, I know Concerta limited supplies. I know some parents have told me that when they have gone to a government hospital, sometimes they have to pay for it outside from an outside pharmacy because there's no stock, etc. So the issue is supply also lah.
Okay. So what are the common concerns that the parents have about the medication? I believe it's the side effect.
So if we talk about side effects, obviously, like I said, the benefit we want to see is improved attention. And we do see that stimulants and also non-stimulants, it has a positive effect on not just attention, but also the impulsivity. So if you can improve attention and impulsivity, you will see sometimes the hyperactivity reduces as well, right? Because if you're more likely to be able to pay attention, you're less distracted, you're less fidgety, etc. Sometimes we see, because they're paying more attention, then we see cognitively some of their abilities also may improve. But we have to remember that it doesn't make you smarter, right? If you have the ability to learn, but your attention is what's stopping you from learning, when you improve the attention, then hopefully you capitalize on your ability to learn, right? It allows you to learn. But if at the start your ability to learn was already a problem, so you already have delays in your development, etc., starting medication not going to make you smarter by making you cleverer. Yeah, your ability to learn is still there. It's not going to make it faster for you to learn. Yeah.
So using the medication does help us to see how much our kids can
pick
improve
up.
and pick up. Yeah.
So not just from a learning perspective, but we also start to see that they become more attentive to what's happening around them. And this is also the time where it's then easier to teach them about dangers, like, hey, when you cross the road, you must pay attention, right? Okay, and you may find there's an effect there as well. And also the impulsiveness to react to something may be less because you're able to talk through what you're trying to work on, right? So it also allows behavioral strategies to then work.
Correct. Yeah.
Because the child is easier to work with because they're paying more attention. Yeah.
I actually have one child after he started, I think he's very mild autism with ADHD. Yeah. So after the medication, we can see him mingle very well with friends. You know, he has more. He himself also feel better where he actually can concentrate. The thoughts is not moving too fast. You know. Yeah. And he's able to complete worksheet, write an essay, and things like that. Yeah.
So that's the positive effects. When we talk about side effects, now remembering that the medication, we want it to go to the parts of the brain that, because it works on the balance of chemicals in your brain, right? Basically your dopamine reuptake. So if we want it to work on specific parts of the brain, but whenever you take a medication, it cannot just go to a certain part of the brain. It will be all over. So we know that if attention improves, the same medication can also cause your mood to be disturbed. So like the older kids will start telling you that they feel a little bit more depressed, okay, or their mood is low. And depending on the dosage that we give them as well. Some of them, their appetite is suppressed because there are also these nerve endings in your gut, right? So then they may feel more full very, very quickly, or their appetite is not as good as it was beforehand. They don't feel so hungry. The other thing as well is because you're more alert, it may also affect your sleep. Okay, now this is where stimulants affect sleep more, okay, all right, than non-stimulants. But we find if the medication is timed such that it's given and it's active in the body up to a certain time, then after that they should want to fall asleep again. Okay, and then there are rarer side effects like headaches. Okay, the other thing that it can unmask is tics. Okay, so involuntary movements, muscle movements. However, it doesn't cause tics, means it will just make it more obvious in children who have tics. And tics is a common problem even in neurotypical children. Yeah. So those are the main side effects that we see.
The challenge with the ADHD child is they probably have difficulty in sleep.
Yes.
And taking this medication will also cause difficulty for sleep.
In some children, yes, definitely. And then we have to manage the sleep separately. We may need to use things like melatonin to help them fall asleep if they are too alert. Yeah.
Does this side effect also include causing like cardiovascular related risks?
Okay, so that was we call it a black box warning at one point, right? But there have since been a lot of studies that have looked at the long-term effects of taking medication long-term, etc. So at one point there was a concern that people who took stimulant medication especially are more likely to die of cardiovascular problems at a younger age, right? But actually when they analyzed the data, that was not true. Over the years now, there have been a lot more, millions of people taking medication. And the same risk factors for cardiovascular disease exists for people with ADHD as with people who don't have ADHD. So if you smoke, you drink excessively, you don't watch what you eat, you don't exercise, etc., you are more at risk of heart disease. Now, you also have to remember that people with ADHD are more likely to partake in things like smoking, taking drugs, etc. So their lifestyle itself may be predisposing them to more non-communicable disease like diabetes, heart problems, etc. Because they are less likely to be attentive to those things that are health related.
So that means with or without the medication
Yes.
is actually
The risk factors
is there anyway.
depending on your lifestyle. Yeah. So although you will see a lot of doctors will want to check your child's blood pressure, weight, right? The weight is very important because if your appetite is poor, you don't eat well, that will affect your growth, especially in your puberty years, right? So that's why we need to monitor the weight. And find strategies to make the child eat, right? Number two, the blood pressure. So why do we check blood pressure at least every 6 months? Is if we pick up increases in blood pressure that are not healthy, we will want to check whether it's related to medication or not. Yeah.
So, Doctor, can you share with us the parents, an example of parents start the journey of medication? Maybe you can share with us how does it look like?
So and this is probably a lot of developmental pediatricians do this, right? When we start medication, we will go through the whole positive effects, side effects. How do we deal with sleep issues? How do we tackle the not eating? So for me, I will always tell parents, you got to make sure your child eats breakfast. Even if it's one piece of cream crackers or half a piece of toast with butter or peanut butter on it, I don't care, but they got to eat something when they take the medication in the morning, before they go to school. And we basically we don't start at the full dosage. We may most of us will start with a quarter of a tablet, don't care how heavy the child is. And then we will tell parents to increase either in increments of 4 days or 8 days. It's called a stepwise increase. And we will tell parents to monitor and see how is their response in terms of their focus, their learning. So this is where communication between parents and the teachers are very important. Then we may say, okay, at any point if you see the side effects are worse than the positive effects, you may have to step back until we get that balance. Okay, so we give parents some strict guidelines, and then we will ask the parents to come back to see us after a month, after 6 weeks. For me, I tell parents to communicate with me after the first week or 8 days, and then via email, drop me a line, all okay or okay, not okay. We don't just suddenly stop. We troubleshoot. We might stay on that dose for longer, just to let that child adapt to the medication. Then sometimes we see the side effects reduce. Yeah.
Okay. Do you have an experience where the parents is like, actually medication, you see the medication will definitely help these kids, but because of the parents' belief, and they worry about the side effect and they will not want to try at all. So how do you convince them?
I present to them the pros and cons of medication. I will sometimes ask them, do they want to talk to someone about medication? And I will see if I can find another parent who's willing to talk to them. Nowadays, most parents don't want to talk. They will go to social media. So then we will try and iron out what they feel the reasons of not starting medication is. And I will try and reassure them. And for me, at the end of the day, if it's not working, it's not working. We stop it. Right? And I say to parents, as long as we come to a conclusion, but why don't we give it a try? Because it may help your child.
Doctor, how long do you want the parents to try? Some of the parents, I think a lot of doctors can prescribe medication, some of them, they just try 1-2 weeks, they say, oh no, I don't feel like doing it, then they stop.
So that's why I say to parents, you keep in touch with me. Our agreement is we don't stop without my permission or without discussion. Not so much permission, but without discussion.
Yeah.
And to be honest, there have been very few that have stopped just like that and not come back. Okay, and I give them that and I think for a lot of parents, that's sometimes reassuring lah, that we can bounce off any concerns. What I've noticed is I tell parents, if we're going to try this, let's see after 6 weeks. If he has weight loss, his appetite is really bad after 6 weeks, and we weigh him and his weight has dropped more than a certain amount, then yeah, we'll stop the medication and we'll give it a break and we'll try again maybe after 6 months or whatever. So I will always tell parents, when you're taking it for the first 3 months, you must take it every day, because the body has to adapt to it, and we won't see any benefit until after 3 months. It's a bit like therapy. You're not going to see any benefits in the first few weeks of doing therapy.
Correct.
Right? It may even take 3 months. Then we see in the longer term. Yeah. Obviously, for the kids who are able to give feedback, they will sometimes tell me, oh, my friends like me now, or you know, I can do work, teacher is very happy with me, and things like that. That's helpful. And the children advocate for themselves. Yeah. But if they can't, then we rely on external observations.
So, doctor, I also know that not only developmental ped can prescribe this medication. Maybe you can share with us who actually can do this.
To be honest, in some countries, only a developmental pediatrician and psychiatrist can prescribe, right? When I was training back in the UK in the mid-90s, to prescribe medication, we would have a big conference of the psychiatrists, and it was only psychiatrists who could prescribe in those days. A psychiatrist, usually the caseworker, which is either a social worker or a psychologist in the team, we would get feedback from school teacher, and if there's a therapist and all that, then it used to be a team discussion to prescribe. And then of course by the end of by the early 2000s, by the end of the century, pediatricians were allowed to prescribe. Developmental pediatricians were allowed to prescribe. And in Malaysia, psychiatrists, by right, developmental pediatricians only. But we know now that any general pediatrician can also prescribe, okay? Because ADHD is a common condition, etc. Yeah. But my advice is, if your doctor is telling you, oh, it's only positive, then no, that person doesn't have the experience of managing it. Yeah. One of the side effects I didn't talk about was the emotional side effects related to being, I told you that children feel depressed, low, right? The older children can tell you they feel low, but the younger children cannot, even if they're verbal, they cannot tell you they feel depressed or they feel low. But they tend to be more tearful or a little bit more irritable. But that's the transition phase. What I've noticed for some of the children that come to me later on, the parents tell me, oh, we tried it before with this doctor and it didn't work. And when I ask them why it didn't work, oh, he was crying so much, or he was getting angry in school so much, right? Children who are feeling low mood or depressed, sometimes they act angry because they don't understand their feelings, right? And then when we talk about it, it was that stopped. Or they didn't eat very well. The doctor didn't explain that the child must have breakfast. So they never eat until like afternoon. So we know when you're hungry, you're grumpy, right? So that's why you got to make sure that your doctor really explains these things to you.
Yeah, I agree. I feel like it's so important to get a doctor that you can trust and journey this important phase with your child and the family together. Yeah.
One of the reasons I was sitting on the fence about medication for my son was the side effect that I read that it will cause them to be shorter than usual. Yeah. So I was thinking, I already not tall. Why if I let him take the medication, I will make him even shorter. Then this one I cannot let go. Second reason was there's a risk of cardiovascular diseases or conditions. I worry that what if he take the medication, then 1-2 months later he have heart problem, how can I accept this, because I had to say yes to the medication first. Then the third thing is he would become grumpier and bad mood, especially after the medication effect wear off. Then I also think the medication is like taking away his true self and convert it into something that is not him. Then am I really helping him by doing that? Because it's like he's like that, but I take medication, chemical compound, to change him for a few hours so that I get my peace, I help him to learn. But judging the side effect, and especially the cardiovascular diseases one, not just so much about the height, is it really worthwhile to try? So that was the real concern that I have. Then during the few months of tinkering, right, then he shows some progress in his ability to sit still for a longer time and to learn better and take instruction also better.
He's telling you I don't need medication.
So I think it's about deciding when is the right time to do it and why are you doing it, right? If you're doing it to please the teacher or because you want to keep your ADHD child in a classroom with 50 people, I would say that's the wrong strategy. The first strategy I would say is 50 or 40 something in a class is not the right place where for a child with ADHD. Of course, in some situations you can't. There are cases where the parents cannot afford, they can send their kid to smaller scale classes, or we don't think the child is bad enough to go to Pendidikan. We may prescribe the medication, so we will look at that context as well, right? But I would say to you, having your kids best and you know what their emotional state is. For the kids who verbalize, some of them can actually tell us they feel like they are not, their brain is not the same, right? And I still vividly remember one of the earliest kids that I worked with. I mean, I was a trainee, and listening to him talk about how he felt when, he was a very creative boy when it came to drawing and all that. But because of that, he was always distracted and he couldn't pay attention in class. So he said, it helps my teacher not get angry with me, but I don't have any good ideas when I take my medication. So then we had to rationalize with him about the fact that, and the psychologist had to do some individual work with him, saying that in the classroom, sometimes we should keep our brain focused on this and leave our imagination till after the classroom. So then we came to a conclusion with this boy, and also because it was affecting his appetite, that at the weekends we would give him a break so that he could have that creativity. He could also catch up with his eating. So then it didn't affect his growth, it didn't also affect his need to want to be creative and
Doctor, I also know that some parents, because they know that a lot of parents, they stop and they don't want to go into this path is because they know that this is long term.
And some in the past, people would say once you start medication, you shouldn't stop. It's lifelong, right? Shortage of medication has shown us that sometimes we have to stop. But my discussion with parents is always, yes, we use medication. If it's helping the child, we continue. At some point, I will ask you to take a break and see how it is. Like, for example, maybe we do it for a year, and then if you want to start the new school year without the medication, and let's see. But we also involve the child in the discussion if the child is mature enough, right? Obviously, the discussion will be different if there was a lot of side effects. And that's when we sometimes do say, take a break at weekends, let him eat and grow. Or take a break at weekends so that he's not so quiet, that he's more creative, etc. But is it long term? This is a discussion we have continually. If we think after 1 year it's helping him, and if he thinks it's helping him, let's carry on. But if it at some point, and I often see this for the children who know they're on medication and understand what is happening to them, and even children with mild ASD with ADHD, some of them at some point will say, I don't want to take this anymore. And we have to respect that, right? And I will say, okay, why don't we give it one term? You don't take medication, but we see how you do. Yeah. And then reassess back again.
Thank you so much, Doctor, for your time, for sharing your knowledge and experience with us today. And I think medication can be a very sensitive topic for many families, and we really appreciate the ideas, to give parents not like just read from Facebook or from any social media, but really know the information from a doctor and get a right doctor, a doctor that you can trust to journey with you, together with as a family, the child, to journey this. I also know that every child is unique, so no one size fit all kind of approach. Whether your child is taking medication or considering it or not, you will not use medication at all. So the most important thing is to making informed decision together with a trust healthcare professionals and focus on what helps your child thrive in the future. So thank you for your time.
Thank you, Doctor.
Yeah, and whoever that find this podcast helpful, feel free to share with people around you.
Yeah, and if you are thinking about medication, like me thinking, yes or no, maybe this episode will serve as a better resource for you to refer to, rather than just go to, ask ChatGPT or different AI, should my son take medication or my daughter. I think this is a better resource for you to digest first before you go to do what you want to do. And always take professional advice and share your concern. I think it's very important because this medication is something that we put into our children's body. It's not like eat candy, that kind of things, right? So yeah, with that, thank you again, Doctor, and thank you to the listener and audience, and thank you for coming for hosting the episode as well.
Thank
you. Bye bye.
Bye bye.